Good day and welcome back to the Valder Beebe Show. I'm moving on to my next guest. I'll be speaking with Dr. Yulia Linares. She's here to give us some information, and I want you to listen closely about blood cancer. Dr. Linares, welcome to the Valder Beebe Show.
Thank you. My pleasure.
Okay, you come to talk a very complex subject, but they told me you're going to make it real easy for us regular humans to understand. So let's talk about B-cell lymphoma. Tell me what LBCL stands for. Because, you know, when we go to our doctors for different things, they use these acronyms and these terms, and you're sitting there going like, oh, Lord, I only graduated from college. I didn't go to medical school.
Large B-cell lymphoma is one of the most common blood cancers, and it's a cancer of the cells that are called B lymphocytes. It is very treatable, but unfortunately, in 1 in 3 patients, after initial remission, this lymphoma will relapse and come back. So the regular approach to relapse detection is watchful waiting. So basically, physicians monitor patients with physical exams and with scans to detect relapse. And currently, we don't really have good methods to recognize who is going to relapse and when, which can be quite nerve-wracking for patients, for their families, and for their physicians. And in the Alpha-3 trial, we are addressing the question of predicting who is at the highest relapse risk and how do we prevent this relapse from happening.
Okay. Let me ask you, if you have this cancer in your blood, does it turn into an actual cancer or does it just live in the blood?
So lymphomas, including large B-cell lymphoma, live in the blood and in lymph nodes. Once these cancer cells are present in blood and lymph nodes, they will eventually grow and create a whole new symptomatic cancer. So what we're doing here is, instead of waiting to detect cancer relapse with physical symptoms, basically patient getting sick, or on the scan where the tumor is large enough to be seen on the scan, or when patients' blood counts are bad enough to know that the lymphoma is there, damaging their bone marrow. What we're trying to do here is we're trying to recognize, to detect large B-cell lymphoma at the minimal level with minimal residual disease testing. Minimal residual disease test is a molecular test, molecular methodology that detects cancer signature in blood at the lowest level. When the signature is present, when minimal residual disease test is positive, it means that this patient is at a very high risk of relapse. What do we do about that? So currently, we don't have any FDA-approved treatments for minimal residual disease level lymphoma, and we're trying to address that in Alpha-3 trial.
Tell me a little about Alpha-3 trials, and is this something that someone with this disease can participate in?
Yes, absolutely. So normally, when patients finish initial therapy for their large B-cell lymphoma and appear to be in remission, we don't know what their chances of relapse are. On this trial, we are studying 2 breakthroughs. Number 1 is minimal residual disease testing. After completion of initial therapy, patients are tested for minimal residual disease. When it's present, it means that they're very likely to relapse. So what do we do for that? This is where the second part comes in. The second part utilizes novel immunotherapy called cema-cel. Cema-cel is chimeric antigen receptor therapy. Chimeric antigen receptor cells are immune system cells that are trained to specifically attack and kill cancer cells, in this case, lymphoma cells. In Alpha-3, what we're doing is we're administering cema-cel to patients who are positive for minimal residual disease. Basically, they're not in relapse yet, but we know that the relapse is very likely to happen. And we're looking forward to seeing the results of this trial.
Is this a creating a way to treat this in the future?
Absolutely. So the trial is ongoing, and once we have all the data, it will be analyzed, and we will know whether this approach is efficacious.
I want my audience to know that I've been speaking to Dr. Yulia. She is a lymphoma specialist at the Miami Cancer Institute. Where do my patients, my caregivers, where do they get more information? Because if they hear you, they probably have some kind of hope. How do they carry that hope out? How do they get more information?
Absolutely. They should go to alpha3trial.com for more information on this revolutionary trial.
Well, you're a revolutionary doctor, Dr. Yulia. I really, really appreciate you stopping by the Valder Beebe Show and educating my audience. You made it understandable. Have a great day.
Thank you so much.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.